The new suicide and mental health hotline officially goes live today. Now, when people call, text, or chat 988, they will be able to talk to a professional for mental health related crisis support. Local 12's Chelsea Sick is here to show us exactly how it works. Chelsea?
Well, if you call or text 988, you will be connected to local trained counselors who are part of the existing National Suicide Prevention Lifeline Network. Those counselors are expected to listen to callers, understand how their problems are affecting them, provide support, and connect them to resources if necessary. The FCC says it adopted rules to expand access to the National Suicide Prevention Lifeline to better serve at-risk communities in crisis. All phone and text service providers are required to direct the 988 calls to the existing National Suicide Prevention Lifeline by today. The executive director of the National Alliance on Mental Illness says this is a much-needed change.
It's the same as the previous National Suicide Prevention Lifeline. It just now, instead of having to remember a 1-800 and a whole bunch of numbers, which is really hard to remember, you just have to dial 988, just like you would dial 911 in any other kind of health emergency. You dial 988 in a mental health emergency.
The former National Suicide Prevention Lifeline will remain active despite 988 being launched nationally today. Coming up later, I do explain what has been happening locally to make sure 988 was up and running by today. Catherine.
Thank you, Chelsea. We'll have more information, of course, on this on local12.com. Now, the National Suicide Prevention Lifeline started in 2005. There were 3.6 million calls, texts, and chats in 2020 alone. That number is expected to double in the first year of 988.